Hello, my name is Dr. Dhaval Misri. I am pediatric and laparoscopic surgeon at Bodykraft Medical Center. So we are talking about hernia today. Hernia is a defect in the muscles through which internal organs, most commonly fat and the intestines, try to protrude out of your body. So you may experience a bulge or swelling, which may changes its size with your posture. It might give you some pain, and sometimes it can lead to obstruction of your intestines as well. A hernia is basically a defect in your muscles, so it could be congenital, being present since birth. It can be acquired. It is usually because of the muscle weakness. So, smoking predisposes to muscle weakness and eventually hernia. If you have chronic pressure on your abdomen, like so, say for example, because of constipation, cough, or difficulty in passing urine, it can also lead to hernia. There can be external hernias and there can be internal hernias. In external hernias, inguinal hernias, which are present in your groin, are the commonest hernias. Apart from that, there can be ventral hernias around your umbilicus. There can be incisional hernias at the site of your previous surgical scar. And there can be some rare hernias like femoral hernias. And as far as internal hernias are concerned, hiatus hernias are the most common hernias. For external hernias, the swelling is the most common symptom. It can be associated with pain and discomfort. And when they get complicated because of obstruction, there can be vomiting, inability to pass the stools, and there can be abdominal distension. Hernia is a clinical diagnosis, so usually you don't require any test to diagnose it. We can see and diagnose it. But when there is a doubt, you can opt for a radiological scan in terms of ultrasound, CT scan, or MRI to confirm the diagnosis. No, hernia usually don't heal by their own, and there are no medications or herbal teas for the hernia. Surgery is the only definitive treatment for hernias. Surgery can be done by conventional open method where an incision is put over hernia, the hernia contents are reduced, and an artificial net, which is called mesh, is put. Now, minimal invasive technology is also available where we do the surgery with laparoscopy. 3 or 4 small keyhole incisions are kept on your tummy. We put instruments and mesh through it, and hernias can be repaired with it. So we do surgeries with laparoscopy. So recovery is faster, hospitalization is short, and the infection risk is minimal. For young patients, we can discharge them on the same day after surgery, and for older patients, they might have to spend 1 night in hospital after the surgery. We expect patients to walk by themselves from the day of surgery. They can resume their diet 4 to 6 hours after surgery, and they can go back to their work within 3 to 4 days after surgery. Yes, there are certain measures which you can take to prevent hernia. We should avoid smoking so that our muscles don't get weak. We should seek clinical assistance if we are having any difficulties with constipation, urinary problems, or chronic cough, so that it doesn't increase this pressure on our tummy and it doesn't lead to hernia.